Heart health is something most of us don't think about until it becomes very real. And when it does, having the right care and technology close to home can make all the difference. Joining me now is Rob Montagnese, President and CEO of Licking Memorial Health Systems, along with cardiologist Dr. Hassan Rajoub. Gentlemen, thank you both for being here.
Great to be here.
Rob, let's start with you, if we could, please, and help us understand why it is so important for Licking Memorial to invest in heart care technology that's useful to the whole community.
If we can provide a service at a very high level in terms of quality, and our population supports that service in terms of the size of our population, we need to make it available. And cardiology is a great example of that. We have been able to attract some of the finest providers, not just in the state, but really throughout the country, that make cardiac services available right where people live. And time is muscle when it comes to cardiac care. Dr. Rajoub and the entire staff do just a phenomenal job.
Well, and let's turn it now to Dr. Rajoub, and let's bring it to the patient level, if we could. Can you explain why someone might experience a blocked artery in their lifetime?
Well, it has to do with your lifestyle. We all live really, in general, terrible lifestyle. I mean, lack of exercise, diabetes, obesity, smoking. It's very common. I mean, coronary artery disease is the leading cause of death and morbidity in the country. And in Central Ohio, we really have a lot of problem with obesity and diabetes and smoking. So that increased the risk of having blockages and heart attacks and ending up with congestive heart failure and more heart trouble.
And it may sneak up on folks. Maybe they don't know they are experiencing some symptoms or warning signs. Doctor, what can we look out for day to day as far as warning signs that one of our arteries may have a blockage?
Well, the first thing, you need to have a healthy lifestyle to start with. And then if you start noticing any symptoms, any chest pain or pressure or heaviness in the chest, or even, it's more atypical even in women. That's why women get delayed treatment, because they end up with more shortness of breath and more subtle symptoms. So they end up delaying going to the hospital. So if you have any of these symptoms, you need to see your provider. If it's severe heaviness or tightness in the chest, especially if you're nauseous with it or sweaty, you should go to the emergency room.
These are signs we should not ignore.
Right, right. These signs should be discussed with your physician, or go to the emergency room if you have them. Even if the middle of the night is 24 hours, we're always available for this. And
doctor, is this something that only affects older adults, or could some of our young viewers maybe need to know that this could affect them?
Unfortunately, the youngest patient we did a heart attack on was 28.
Wow.
And we have a lot of patients in their 30s and 40s. It really depends on your genetics, which is, you can't really do much about it.
Right.
But if you know you have bad genes, it's good to be detected early so you can modify the risk factors.
So let's talk some treatments. They've come a long way, haven't they? We've all heard about the balloon angioplasty to treat blocked arteries, but you say there's a different therapy that can help. Can you tell us more about shockwave therapy?
This is very exciting. This started probably a couple of years ago. I was lucky enough to meet the guy who founded the therapy, which is very exciting treatment. It's a long-standing Achilles heel of coronary interventions, and in the periphery, the presence of calcium in the arteries. Because if the arteries are soft, they're easy to deal with. You can balloon angioplasty and stent. But whereas when you have a buildup of calcium, it makes it very hard. So the shockwave therapy, it's very I would say safe, minimally invasive. We go through a tiny hole in the arm, go up to the heart, put a balloon, and deliver sonic wave that cracks the calcium and makes it much easier to deliver the balloon angioplasty and optimize the stent deployment.
That's amazing. Okay, so what does that mean for the patient? Does this improve side effects, downtime? How does this affect the patient?
Actually, it's very critical. If you have a blockage and you don't open it properly by dilating the artery to where it's used to be, increase the risk of shutting down immediately, forming thrombus, causing a heart attack. actually makes the stent re-narrow instead of like in a few years and be probably a few months sometime. So it really affects the outcome immediately and the long term for the patient.
This shockwave
The
treatment.
shockwave, yes.
All right. Rob, you talked about why it is important for Licking Memorial to invest in these newer type treatments that are better for patients. What are some of the factors that you look for when you're trying to find these better treatments for patients?
We have a great group of 2,600 plus employees, and they are well trained, well vetted, and they are always out there looking at the latest and greatest technologies, pharmaceutical interventions. And once again, we use a very basic test. If experts like Dr. Rajub, our nursing staff, our therapists can leverage that to take care of our community, we will make it happen, make it available.
Rob, we have viewers right now watching, and they are looking to reach out to Licking Memorial to find out more and how these treatments could help them. What's the best way to reach out to you guys?
We have a wonderful website, very comprehensive. So if they go to lmhealth.org, it has all of our activities, all of our education, all of our services, providers. I would recommend the website, and we would be happy to help them out.
Rob, Dr. Rajub, thank you both, gentlemen, for being here today.
Thank you for having us.